Welcome to the Virginia Hospital and Healthcare Association's Patients Come First podcast series. Podcast episodes are available on VHHA.com and on popular podcast hosting apps, including Apple Podcasts, Amazon, Spotify, and many others. We're a member of the Public Health Podcast Network, the Virginia Audio Collective, and the Family Podcast Network. Podcast episodes also air each Saturday at noon and Sunday at 10 a.m. on 100.5 FM, 92.7 FM, and 820 a.m. across Central Virginia, 1650 a.m. in Hampton Roads, 105.1 FM and 1050 AM in Lynchburg, and Wednesdays at 1 p.m. on 93.9 FM in Richmond. Please send questions, comments, feedback, or guest suggestions to pcfpodcast@vhha.com. Again, that's pcfpodcast@vhha.com. And today we have a pair of guests joining us from Inova Health System in Northern Virginia. They are Dr. Henna Qureshi, a board-certified pediatrician, and Leigh Guarinello, Director of Community Health Programs with the health system. They join us for a conversation about their work, Inova's community health efforts, Unite Virginia, and more. But first, welcome to the show. Thanks for being with us.
Thanks for having me. Thank you.
Well, it's our pleasure, and we appreciate you both for making some time out of your busy schedules. It's our custom to start each episode by getting to know our guests a bit better. We'll start with Dr. Qureshi for this one. We know that you are passionate about health equity and humanitarian work, such as disaster relief and refugee medicine, and that you have provided clinical instruction at UVA and VCU. Beyond those few professional details, what are some essential things about your unique personal story that people should know?
Thank you so much. I would say that I think what's important to my story is just the patient population that I've had the privilege to serve in Northern Virginia. It's a predominantly immigrant and Medicaid patient population that I have had the pleasure of working with for the last 10 years. And in the last few years, I've been able to serve as a physician health equity lead for the Inova Health Systems, which has given me a unique opportunity to understand their needs outside of the clinical setting.
And we're going to delve deeper into that exact topic here in just a moment. But before we do that, we do want to chat also with Leigh and just find out a little bit more about her story as well. Leigh, we know that you studied at UVA and Yale, that you previously taught at George Mason University. You have experience in public health research, and you've been with Inova for the better part of 2 decades, including 4 years in your current role. So with that background, tell us a bit more about yourself.
Sure. The vast majority of my work at Inova has actually been in HIV with the Inova Juniper program. So with my background in public health, I did a lot of work on community connection and engagement, education for healthcare providers, and prevention of HIV work, STDs, which also brought me into the LGBTQ plus space, where I am now also volunteer inclusion director for Equality Loudoun. So I have a real passion, as Dr. Qureshi just shared, for our under-resourced, under-invited communities. All of our time at Juniper is also similar to what Dr. Qureshi shared, an organization that serves the marginalized communities in Northern Virginia. So I love that work, and I kind of moved over into population health and community health and health equity as a whole, which really feeds my passion.
Excellent. Well, I appreciate you both sharing a little bit more about your stories. One thing that we want to cover today is gaining a better understanding of how Inova approaches community health efforts with an emphasis on equity and the social factors that are influential in health and health outcomes. Leigh, let's toss this one to you. Can you give us a bit of an overarching perspective on that?
Sure. I'm actually looking at an image. It's too bad this is a podcast because I've got a beautiful image to share around this, but for Inova, we really think of health equity as woven into all aspects of our culture at a foundational level. We work with the Community Health and Health Equity Division, but the work of health equity cannot be limited to one sphere of a health system. So within our division, we have community care clinics and programs. We work with the Healthcare Anchor Network. We provide grant opportunities to our nonprofit partners, and of course, the community health needs assessment work. But we know that health equity and community health work is also tied into our system, philanthropy, analytics, our electronic medical record, government relations, kind of across the board. And of course, all the work that our HR team does related to DEI. And then, of course, all the work of clinical excellence that intersects the data that we collect around social drivers of health, around race, ethnicity, and language, and viewing our outcome measures through those lenses. So we really see this as a system-wide approach. And then we have direct community structure where we have a health equity steering committee. We have community action committees that bring together stakeholders to talk about how the community sees our work.
Well, as you said, it sounds like this really is woven into the fabric of the organization across multiple departments and disciplines, and that's a good thing to hear, so I appreciate you sharing that overview. Dr. Qureshi, you mentioned working with diverse populations, and as we noted, ANOVA is in Northern Virginia, which is a broad region and a population center for the Commonwealth. It is adjacent to the nation's capital. It's home to a diverse community of folks from many backgrounds, cultures, and nationalities. I imagine serving a population like that brings with it unique opportunities, requires a dose of sensitivity and empathy, and some logistical management. So when you look at the region through that population health lens, Dr. Qureshi, what observations do you have about effective strategies for healthcare organizations in serving diverse populations?
Sure. Thank you so much. Well, I think when we define diversity, initially we often think of, multicultural and the various languages that are spoken. I think what's unique about Fairfax County, I think there's over 139 languages spoken in the region. I think being cognizant of that diversity within the communities that we serve and reaching our patients in the preferred languages that they have is important. But I also think that COVID sort of demonstrated that equity and needs of patients crosses all sorts of socioeconomic levels as well as cultures. And I think what's important about INOVA is that we make sure we're serving all patients across all socioeconomic needs and all various cultures. And I think that that's an important thing to think about when you think about Northern Virginia, that we may have those of the most highest socioeconomic needs along with those that are more marginalized and of lower socioeconomic means. So I think as long as we are thinking about that diversity in the patient population that we have, we're able to provide access and resources that can serve the entire population.
And Dr. Qureshi, you mentioned earlier working with Medicaid beneficiaries among your patient population. I think it's always important to point out to our listeners and to remind the public that here in Virginia, Medicaid expansion actually occurred in 2018 with legislative approval and with enrollment beginning in 2019, thanks in large part to the role of hospitals in helping to facilitate that approval. In fact, the state share of costs for the Medicaid expansion program here in Virginia are funded by Virginia hospitals. That was a key point negotiated in the brokered deal in order to accomplish that. So Medicaid expansion is helping hundreds of thousands of low-income working adults who previously may not have had access to coverage to gain coverage over the last 5 or 6 years, but also hospitals have been front and center, not just in the provision of care, as clinicians like Dr. Qureshi are doing, but also in actually financially committing to and investing in that program. So we just always like to remind people of the work hospitals are doing, both on the clinical side and in investing in access to care. I want to drill a little bit deeper down into the notion of population health and social determinants of health. Leigh, this is an emerging area within the healthcare space. There is, over recent years, just greater awareness and appreciation for the role that social factors, access or lack thereof to nutritious foods, access to educational attainment, transportation access, and a whole host of things, how these things impact individual and community health. There are some data that suggests that, as much as 80% of an individual's health and health outcomes is actually influenced by these social factors. I wonder if you can just help explain for the listening audience a little bit more about the role of these social factors in influencing health outcomes and why, in response to that awareness, that healthcare providers are increasingly focused on not just the acute clinical supports, but also in trying to support initiatives, programs, perhaps in collaboration with community partners to try to get at some of these sort of broader public health challenges.
Yeah, absolutely. And I've heard that statistic too, and I actually also have heard and seen data on the fact that about 50% of our health and well-being is driven by our zip codes and where exactly we live, which speaks to what Dr. Qureshi just shared about Northern Virginia being known as this sort of incredibly high-income area, and yet we have such significant disparities by community. We are very aware, we kind of talk about this as you can't expect people to do what they need to do to stay healthy if they have competing priorities. We really need to reframe the idea of, well, this patient just no-shows a lot to our appointments, or they're non-compliant, or they're non-adherent. Really reframing that to, did they have a ride? Do they have a refrigerator to keep those medications in? And really thinking about it that way, which is why we're doing screening for all of our patients for these social drivers of health, because they are so impactful. And I just want to shout out Dr. Qureshi, because just last week, she and her team that was working on transportation assistance won an award at ANOVA. So we've had some system-wide awareness of the importance of this kind of work, which is also evidenced, as I'm sure we'll get to, in our adoption of the Unite Us portal as well.
And Leigh, that's a great segue to the next question. We wanted to elevate an anecdote that was shared with us by the ANOVA team involving a young expectant mother who showed up at ANOVA Fairfax Hospital's emergency department this past winter. She was fatigued. She was experiencing abdominal pain. She had an unsettled residential situation, had not had access to prenatal care. A lot of challenges going on. Obviously, there are some things that need to be withheld to protect patient confidentiality and privacy. But Dr. Qureshi, tell me a little bit about that situation and how the team at ANOVA was able to not just address the acute medical needs that this individual experienced, but then also work in steps beyond that to try to address some of these other challenges that this expectant mother was facing.
Sure, thank you. Yeah, and this story is one of so many stories that our patients share with us, and I think it's really important to see the patient beyond their medical needs and kind of, really understand their personal lives and how really they kind of impact their overall well-being. This particular patient could come in, and I was really proud of the ANOVA Women's Service Line in particular, and the way that they provided compassionate care, understanding that this expectant mother had emergent food needs, had been concerned about the safety and well-being of her own health as well as her expectant child's health, and I'd also mentioned some concerns about housing stability and safety and things like that. And so they were able to sort of recognize that need, define her beyond her medical needs, provide a real narrative to her story, and make sure that they could get the access and the needs that they were requesting. They connected them not only to in-house resources that we have when it comes to emergency food services, they also connected them via Unite Us to a series of community organizations that could follow the patient on the outside of the hospital system. And then they gave them a safe place to return. So reminding people that we try to define our spaces as medical homes, a safe space where they can come and access needs. And so that patient and the family knew to feel comfortable to come back. If they had any difficulty accessing the resources, which they did, they returned just to provide some reassurance about, connecting to those community partners. And then they followed them up to some of our outpatient facilities to make sure that this patient and their expectant child could have a safe space to be followed throughout the duration of their pregnancy. And it was really wonderful to hear how well supported they felt, how they felt that they had a safe space to go, had food and access to the resources on the outside, as well as knew that they could deliver their child in a place. And we were happy to hear about a positive outcome of the pregnancy in the last few months. And we've been lucky to kind of follow the patients and their child thereafter. And so it was really wonderful to kind of hear how we made sure to provide sort of an all-inclusive healthcare approach, which we really do try to recognize patients beyond their medical needs and understand that things like food, access to transportation, safety, these are basic human rights. And we make sure that they're obviously so important to our patients and often extend beyond their just acute presentations. And I think our ANOVA staff really approached that in that way.
Well, it sounds like a suite of wraparound services, both through ANOVA and through other partners, were provided, and it sounds like a positive outcome here. I also understand that there was a language barrier with this patient as well, and the team was able to find an individual who spoke the expectant mother's native tongue, and so that also helped facilitate the process. So again, just great to hear that all these resources are being pulled together to support patients in need, regardless of their status, regardless of their insurance status, ability to pay for care, things of that sort. And Dr. Qureshi, you mentioned the Unite Us platform, and Leigh, I want to toss it over to you. Unite Us is a platform that we've engaged with here at the Hospital Association to work with elected leaders to make it more broadly available to healthcare providers and other social service organizations in the Commonwealth to create this sort of virtual network for these connections so that people can be linked up with services. So, Leigh, if you would take us a bit further down that path and tell us about how Inova is using Unite Us and some of the benefits or the assets of that platform in terms of meeting patient needs.
Sure. And I think this story is really evident. I know it's become a bit of a cliche, but the idea of it takes a village, that for this baby to be born and this mother to be healthy, so many different pieces came together, as you just articulated. And oftentimes for our immigrant patients, they come from community, and in their move may have lost parts of that community and that support system, and kind of seeing the immediate hospital, the OB emergency department, and then the outpatient, the Inova Cares clinics, but then also our community partners. We really feel at Inova that we're not everything for everyone, especially when we talk about that 80% of needs. And our community partners are so critical to that work. And so we've been for years creating and maintaining those relationships, partnering with our strong community partners and our nonprofits and our government entities. And when the Unite Us opportunity came on board at the state level, Inova opted into that. We opted into actually building it into our electronic medical record to make it sort of easy point of access for all of our clinicians. We have an unusual approach, according to the Unite Us team, that we work very closely with, and actually opted to basically make the platform available to any clinician that wanted to use it. Now, some folks get more advanced training. Some folks have come to us from the Inova teams and said, hey, we heard this is an opportunity. Can we take advantage of it? And so there's different levels of usage across the system. But we found that those who use it have really delighted in the ability to do more than kind of Googling a resource and handing someone a sheet of paper. The fact that they are able to make this referral to an active community partner who then reaches out to the patient to provide, or at least to connect to resources that person needs. This is just one example. Dr. Qureshi has shared others with me of opportunities where we've seen this. And in fact, we opted to take several of our Inova community serving programs, so our Healthy Plate Club and our Inova Cares for Families, and put them on the platform as a community partner so our partners can refer back to us, that it really is a network. It really is a village where we can all share the resources that we have for our clients and our community.
Yeah, and I love the way you put that it does take a village, and that while a large healthcare organization may not be all things to all people, it has a footprint in a community and can be a catalyst for providing acute clinical care and then connecting patients with other resources in the community. So that really shines through in the examples that you've shared, and just hearing the both of you speak, it's evident to me how deeply you both care about this work and about the patients and the clients that you're serving. So really appreciate you sharing that perspective. We are going to land this plane here shortly, but before we do have a tradition on the Patients Come First podcast to ask our guest a pair of fun personal questions to close things out. To keep things interesting, we have a list of 10 mystery questions. Since we have two guests this time, we'll give you each one question. So, Dr. Qureshi, we'll start with you on this one. If you would select one number between 1 and 10, I'll ask you the corresponding question.
Sure. Number 6.
Number 6. In the hypothetical scenario that you had one-time access to a time machine with limits, you can either travel 100 years into the past or 100 years into the future. Which direction do you choose and why?
I think I would say 100 years into the future to see the important work that's been done, especially in the last few decades, on access to healthcare, health equity, the anti-racism work that's being done. I would love to see in the next 100 years that come to fruition, and that we live in a space that is equitable and that people feel that they are safe and well cared for within the healthcare system.
Hope for the future, a great message. And then Leigh, to you, one number between 1 and 10, please.
I'll take 7.
Okay, number 7. If you could choose one superpower to have or any one skill to instantly master, what would it be and why?
Tough one. I had a better answer for Dr. Qureshi's question. I think it would be the ability to, this isn't really a superhero, this is something you can master, but to be able to truly understand people, like the power of empathy and pull people together who need to be connected and make them stick so that we can better leverage in our personal lives, in our professional lives, all of the resources that are out there and really make those connections stick and be strong.
Interestingly, that is not the first time we've gotten that response to that question on this podcast. So perhaps that is a shared trait or common sentiment among folks who work in healthcare. In any event, we want to thank both of you for joining us today, for making a few moments out of your schedule to share important details about your work and the patients that you're serving and some of the positive outcomes that are yielded as a result of that. And with that, that's going to bring us to the close of another episode of the Virginia Hospital and Healthcare Association's Patients Come First podcast. If you like what you heard, please make sure to leave us a 5-star review on Apple Podcasts and subscribe so that you know when new episodes are available. And we want to once again thank our guests, Leigh Guarinello and Dr. Henna Qureshi from Inova Health System for joining us today. So thank you both.
Thank you.
Thank you for having me.